you wrote about a not very discussed bill called HR 3467, which would automatically enroll Americans into Medicare Advantage. Can you talk a little bit more about what you think the sort of threat is on this bill?
It's about as bad a piece of legislation as I've ever seen. This truly is throwing a lifeline to insurers like Centene, advocated by ideologues who are very supportive of completely privatizing the Medicare program. It would automatically enroll people as they become eligible for Medicare benefits. So we're talking about future enrollees. So if you're not anywhere close to Medicare eligibility now, know this applies to you. It will, and it will not be good for you. It would automatically enroll them in a Medicare Advantage plan. Once you are deemed eligible for Part A, which covers hospital care, and Part B, which covers physicians and outpatient services, automatically you'd be enrolled in the so-called lowest cost Medicare Advantage plan. People wouldn't have a choice, and they would be locked in for 3 years.
And let's real quick define terms for people. Medicare Advantage, right? That sounds great. It's privatized Medicare, correct?
Exactly.
It's all these folks telling us, well, we don't want to privatize Medicare, but they have been, right? And it costs the government more, right? Medicare pays up to what, 15, 20, 30% more into Medicare Advantage, benefiting these private companies. And then I know as a physician, Medicare Advantage notoriously is cheaper, right? The premiums are cheaper and people get health club memberships and eyeglasses and all that. But then when they get sick, the cost sharing, the amount people pay when they need to utilize the insurance is astronomical. And it's much higher than regular kind of bread and butter Medicare.
And guess what? They never advertise that, do they?
They don't.
They spend huge amounts of tax dollars. As we get toward the fall, we'll start seeing these Medicare Advantage ads all over everywhere. TV, social media, trying to lure people into these plans with the promise of these so-called extra benefits. They don't have to tell you a thing about the shortcomings, the problems that you mentioned.